So we're going to talk about how treatment is administered, and this is relevant whether it's chemotherapy, immunotherapy or targeted therapy that you're on. Some drugs are given intravenously, and that can be via a cannula, which is normally put into your hand when you come in for your treatment, and it's taken out before you go home. For some intravenous treatments, we do use a central line, normally a PICC line, which is inserted into your upper inner arm and goes more into the central blood vessels. We would use a PICC line if you are going to be on a regime where you would go home with an ambulatory pump, or for some regimes where the drugs that we use are particularly dangerous if they leak outside the vein and they can cause damage to the tissue. It may be that if you have particularly difficult veins, or if we struggle to get cannulas in, that after you start your treatment, we may look at getting a PICC line fitted later on down the line, but that will be worked out based on your veins and the treatment that you're going to be having. Some drugs can be given via a subcutaneous injection, which is an injection to the tissue directly under the skin. These are normally given into the abdomen or to the upper thigh, depending on the licensing for that particular drug. It can be a bit uncomfortable, but it shouldn't be painful having that injection. Some medications can be given orally. So in that instance, you would be given the tablets to take home, and you would be told, how and when to take them. If you are taking oral chemotherapy or oral cancer drugs home with you, it's really important that they're stored separate from any other medications and that they're kept in their original packaging, not put into sort of tablet dispensers. If you come into hospital, please bring those with you. We're not able to reissue cancer drugs once they've been issued. So if you're in hospital and you're kept in or you're admitted, you would need to bring those with you in order for us to be able to give them. They all are normally stopped when you first come in until you've been reviewed by a senior doctor, who will then say whether or not they can continue. But say please bring them with you if you need to attend. Alongside your cancer treatment drugs, we will also give you what we call supportive medicines, and these are the medication that we give you to take home to help with any side effects that you experience. So most regimes you will be given some anti-sickness tablets, possibly some medication to help with diarrhea or constipation, possibly some mouthwashes to help if you get a sore mouth. But again, we will go through all of that information with you, what those medications are and how to take them when you attend. So we will give you that on your first cycle. So all cancer drugs go through extensive testing and research trials before they're licensed. So the route that you receive your chemotherapy is specific to the disease type that you have and the drug that you're on. Not all drugs can be given via multiple routes. Some can only be given intravenously, some can only be given via injection, and some can only be given orally. They're not interchangeable, dependent on the drug that you're on.